Good morning. I'd like to begin by expressing my heartfelt gratitude for the opportunity to serve this year as the NLMA's 83rd president. That's the first time I've said NLMA right in a year. This has been the tremendous honor for me, and I am very thankful to have worked with all of you to advance the priorities of our association on behalf of our patients and the physicians of the province. It has been a busy year for me personally, but also a very rewarding one. Of course, my year was shaped from the beginning by issues stemming from the Callahan inquiry. When I was sworn in as president last June, physicians were beginning to testify before the commission. At the time, news reports about problems with patient notification and disclosure were beginning to foster an already growing sense of public distrust in Eastern health and by extension in the whole healthcare system. From the beginning, we positioned the association as supportive of the inquiry process, and we seized the opportunity to proactively raise awareness about measures to improve the system and make government more accountable. Since then, additional strains have become more obvious throughout the healthcare system. We've witnessed the vicious cycle that occurs with chronic resource deficiencies, namely physician resignations and serious voids in specialty areas, as evidenced by the most recent departures of the province's only infectious disease specialist and our only pediatric respirologist. The NLMA worked very hard to preserve physician reputation and retain public support throughout the year by informing the public about the systemic dimensions involved, and this continues to be a priority. The NLMA also had the opportunity to make written submissions to Commissioner Cameron to aid in her recommendations, and I am pleased to say that most of our recommendations have found their way into the Commissioner's final report. The realities arising from the inquiry also provided a foundation for our preparations to begin negotiations for a new memorandum of agreement. The consultations with colleagues throughout the year were an integral part of that experience. It was great to have the opportunity to meet with you and to talk about the issues we all face in delivering care to our patients. I am deeply appreciative of your support and wise counsel. During our consultations, two prominent themes always seem to emerge. Firstly, the disconnect between rural and urban physicians, particularly the inability to recruit to rural areas. The second issue raised was the need to establish a level playing field in the wake of recent compensation side deals between physicians and government. There is no doubt that this next agreement is critical for resolving issues within our membership, as well as issues surrounding recruitment and retention. I can assure you that we are continuing to aggressively pursue solutions to these and other outstanding concerns in all areas of medicine. Our objective is simple: a fair and reasonable agreement for all physicians. Newfoundland and Labrador is now a have province, the only province to achieve such status in Atlantic Canada. In spite of this, Newfoundland and Labrador has the lowest paid doctors in the Atlantic region. It's time for government to invest appropriately in health human resources. If we are to ensure that we have an adequate supply of physicians in the future, it is imperative that doctors are appropriately compensated. We must also ensure that there are improved working conditions, enhanced return of service programs, and better incentives for rural practice. Both the NLMA and government have difficult challenges ahead as we work toward a new MOA. Our message to government is that we will work collaboratively and positively, but we must stand firm and united. To move forward, we must work together in an atmosphere of solidarity and mutual respect. We must renew our unity as an association and uphold our common goal of providing timely and quality care for our patients. Because at the end of the day, it's about ensuring that we have a sustainable healthcare system that meets our patients' needs and also provides the highest quality healthcare possible. At this point, I would like to offer thanks and express my gratitude to the many people who have contributed to our association this year and to those who have made my presidency such a positive experience. I am very grateful to our board of directors, committee members, and all those who have served with me during the past year. I'd like to extend a special thank you to my patients and the staff at my clinic for their support and understanding. I would also like to thank my colleagues at my clinic who filled in for me on numerous occasions when I was out of the office. Finally, I'd like to thank Rob and the staff at the NLMA. Your professionalism, expertise, and tremendous support are invaluable to our association. I am confident that I leave the association in good hands with Dr. Brendan Lewis, our incoming president. I look forward to continuing to work with all of you in the coming year in my capacity as past president. Thank you very much.